Today our session is about MRCPCH Part 1, as you all know. And this session is open session. Everyone welcome here because the February exam is very near. Many of candidates will give February exam here. Okay. So this is a open session. Okay. And this is not a educational session, just a uh, review of the part 1 preparation, how we will take our preparation. And if anyone has any query, any topic, we can discuss a little bit. Though I had not prepared any system wise today, I just want to show some new students are here who are actually very new, who does not know what are the syllabus of MRCPCH Part 1 and what are the topics. Okay, so that's why we are here today, so that we can share our experience about the MRCPCH Part 1. Okay, if you have any question, you can just open your mic and you can just tell us. Okay, let me share it on our Facebook group. You all know, right? We have a Facebook group that is called MRCPCH Clinical Group of Excellence. And in that group, we usually communicate with the candidates from part 1, 2, and clinical part. Okay. So, what I prepared for you today is that, give me a minute to, so that we can, yeah, now it's okay. So this is an open session for all of us. We will discuss about part 1 question pattern, part 1 syllabus, everything we will discuss. Who cannot hear me? Uh, am I audible? I think some people cannot hear me. Okay. So this is our course. Just have a glimpse of our course. Now, the most of the candidates ask me about part 1 MRCPCH question pattern. Okay, how the question pattern occurs. Just okay. So I am requesting you everyone to please share your screen Okay, thank you very much. So our target is to pass the exam. Okay, 65, 75, it can happen according to the question easy or question tough. Okay, is that clear? So pass mark, don't bother about the pass mark, just concentrate on the system. What system and what books are needed for MRCPCH Part 1. As today our session is only for MRCPCH Part 1, so I will not discuss anything about AKP, that is Part 2. I am only highlighting the February candidates and the June candidates, because these two exam, I have students now ongoing who are giving exam in June, and some students, I have old batches, they are giving exam in February. So for them also, and for the new students also, for general people, I am arranging this session, because still some people have confusion, like many people have confusion, like am I able to give exam from my home country? Yes, in last October exam, my few of my students and colleagues, they gave exam from Bangladesh by online invigilator, and maximum of them passed. Okay, they pass very easily. There were few interruption, because as you know, for even when I gave exam in India, part 1 and part 2, then also I felt some difficulty. One time my computer get hang. Okay, and then the invigilator, or the computer expert, he came, and then he stopped the computer and then turn again, and he said me, the time your interruption, the time of this interruption will not count. Okay, when the computer hang, that time my exam stopped. I mean, from the RCPCH, they control the exam. So what happened, during my exam, I saw some of the students are still giving exam, but my exam is finished. Why? Because the time, maybe they had interruption, so their time is still not finished. Okay, so this is applicable for home exam also, when you are giving exam at home. But I will prefer, you should take a broadband connection, that is cybernet connection, that is very good for your very good for your exam. Okay, so what you should do, you should take a very good connection, and so that there is no interruption. But I can assure you that if there is interruption, RCPCH, you just tell them that I have some interruption, I cannot hear you, or I cannot see the question, or I cannot see, my computer is hanged. So they will immediately stop the exam, and then they will again restart. Okay, so your time will be stopped. So that means there is no wastage of time. Okay, so be sure about that. So don't hesitate to book exam from home if your country has no center. But if your country has a center, I prefer to go to the center. Okay, suppose India, they have center. UK, they have center, but in Bangladesh, Pakistan, they don't have center. Okay, so I strongly suggest, who do not have center, you can easily book the exam from home with online invigilation. Until now, is there any question now you have? Okay, so as the morning exam is FOP, so we will discuss now the FOP books first. Okay, there is some chats. Is there negative mark in the exam? No. Okay, there is no. Better if you open your mic and ask the question. Okay, sometime I miss the chats. Okay, there is many question like, um, mm, are you on Telegram? Yes, we have Telegram.
I had a quick
And
question, ma'am.
yes, yes, please.
Is there any specificity of the questions, like is this the difficult one or the hard one or the easy one, and the varies of marks difference different?
Yes, yes, because suppose one question of ethics, okay, and maximum student gave wrong answer. That means the question is tough. Okay, that time they usually make a graph, a graph that how many percentage of student give right answer, and from which country they are. Like ethics and palliative, UK students are very good, more than us, in Asian continent or African, because we have less ethics and palliative knowledge, right? So in ethics and palliative, I saw UK people get maximum marks because they are very habituated with these topics. So suppose there is a one question of palliative or ethics, and in that question, 50% students got wrong answer. That means that question is a bit tough. But in a question, 80% student got wrong answer. That means that question is really tough. So um, they usually demarcate. If the question is very hard, maximum questions are hard, and passing, they usually make a graph like this. I am drawing the graph. Suppose this is a graph, okay, and this is 60% marks, 70% marks, 80% marks. Okay, and maximum people got marks around this. Okay, like this. You can see the graph. So 70% marks maximum people got. That means the pass mark will be around 70 to 75, like this. Okay, so this is how the UK usually they calculate the pass mark when the maximum people got marks. Okay, minimum marks and maximum marks, like 60% will be 20% student, and 80% mark will be 20% student, and 60% student got marks around 70 to 75. So they will calculate the pass mark like that. Okay, so
No, my question is this: ki suppose I answered one question which is basically in their terms is a very hard or difficult. If I answered that question right, so will I get the extra mark or like in an easy mark? Will I?
there is no extra mark, there is no negative mark.
No negative. Okay, okay, okay.
Yes.
Sounds good.
There
Sounds
is
good.
no extra mark. Even 99% student give wrong answer. You gave right answer. That will be only 1 mark for one question. That is the
Okay.
maximum mark. Okay.
Hmm.
Okay. Now, so I can tell you one thing, that some student got 100% marks. On the RCPCH, there is written in their website that we are astonished, we are very much surprised that how come one student got 100% marks. Okay, so some student literally got 100% marks. How, we don't know, because they may be very very meritorious and may be very very accustomed with the UK treatment pattern. Okay, because some questions are like some microbiology question, like some biochemistry question, like intron, exon, okay, like cell division, some very very minute detail of a cell division, or a genetic chapter question, very very detailed, that one student should not answer. I mean, one on average student, only higher quality, like higher IQ students only, they can answer. Like some questions are like this, you will see in your exam that some question are really really you never heard of that question. Okay. Okay, so what are the FOP cases book, FOP exam book? Okay, we will prepare our morning FOP exam. What books we will need? First of all, we need guideline. Okay, both pediatric and neonatal guideline. Okay, let me just share this one. Okay, so in our now we will practice red book. Okay, red book pediatric guideline and blue book neonatal guideline. This blue book 2021 up to 2021, they are valuable, I mean applicable, but red book actually expired. Red book last edition was 2018 to 2020, so it's nearly, I mean, nearly now not applicable. But until new guideline comes, I hope new guideline will come in between August, okay, August 2020-21. So before that, you have to read Red Book. And remember one thing, guideline will not change 100%. Only 1 to 2% will change. So 98% guidelines are similar. So even if you read Red Book or Blue Book, nothing matter. Not a, I mean, it will not be your fault. You can easily grab the new one, okay? Like I read Green Book. Green Book was the 2016 to 2018 edition. Okay. And then I got Red Book. So I saw most of the chapters are similar, except 2 3 chapters that were added. Okay. So this for the FOB books, FOB exam, main book is guideline. Okay. Nowadays in RCPCH, they are highlighting the neonatal guideline also, highlighting the neonatal chapters also. Previously they did not give so much neonatal question, but nowadays people are actually very meritorious, and they are actually they are doing very good. So nowadays, day by day, it is increasing. Okay, day by day the guideline is increasing. Like neonatal guideline, nowadays they are giving question from neonatal guideline. And one important topic is that neonatal sepsis and neonatal jaundice and neonatal like neonatal hypoglycemia, hypocalcemia, neonatal seizures. Okay, these are very paid topic. very favorite topic of RCPCH. So I think you should also read neonatal guideline, that is blue book also. Okay, any question until now? Okay, then we have okay, be careful about your videos. Okay, videos are open. Just 1 minute. Okay, sorry for the interruption. So nowadays, we are doing these guidelines and just red book and blue book both. Okay, now the second book is FOP cases book. Okay, this is a yellow color book, you all know this book. And this book has 50 cases. These 50 cases, actually, one case is one chapter. Okay, suppose the first case is about poisoning, second case is about eye, third case is about respiratory system, fourth case is about cardiovascular system. So one case is based on one system. Okay, and that is a very, very nice book. If you see the RCPCH syllabus for part 1, you see this is the main book for FOP cases book. And this book is also based on some guidelines. And these guidelines are the red book and blue book. Now, many people ask me that red book and blue book is enough to read. Actually, no, because red book and blue book has lackings of some chapters, like celiac disease. You will not find celiac disease. You will not find asthma, chronic management in the red book. You will find the acute management, but not the chronic management. Then you will not find IBD, that is Crohn's disease, and ulcerative colitis. So from where you will read those topics? Best is you will just type in the Google www dot, okay, then niceguideline.com, and all the nice guideline you can see. Okay, and any nice guideline is downloadable. I mean, easily you can download. Okay, so just remember that we can easily download this. Um, we can easily download this nice guideline, the celiac disease, cystic fibrosis. Okay, so it is not a matter of worry. Okay, everyone, let us start again. So we discussed about the guideline in red book and blue book, and also we discussed FOP cases book. Now, ethics and palliative. Ethics and palliative are equally important for both FOP and TAS. Okay, for FOP, ethical question will be clinically based, like treatment or investigation. Okay, and for TAS, ethical and palliative question will be a little bit basic, like pharmacology of palliative care, like morphine. So they will give question regarding the morphine side effect, how to manage morphine side effects. Okay, so ethics and palliative, I have one live session for ethics and palliative in my group, FCPS Excellence, okay, MRCPCH Excellence group. You can see those live session. It is very, very helpful, I think, because these live sessions I took with a vast preparation, like how you will crack the ethical questions about death, like brainstem death, or ethical question about treatment, withdraw, or ethical question about sex, that is teenage sex, or pregnancy and contraceptive, okay, like non-accidental injury. So those ethics and palliative live sessions are very helpful. You can take help from that. And where we will read this, where can we find this resource? Okay, in my Telegram channel you will find many, many books from RCPCH, like everyday medical ethics, like you can also find in patient info, patient info website, like this patient info. Just you will type ethics in pediatrics. Okay, patient info. This website has many, many important materials for doctors in all the subject, not for pediatrics only, for all the subject. So you can go into patient info, then you can type. Also from RCPCH they release many ethical books every year. Okay, so you can find those ethics and palliative from RCPCH website, or from patient info website, or from Telegram channel. Okay, I have this Telegram channel I shared in my WhatsApp many time, I shared in my WhatsApp group many time, I shared in my Facebook group. Okay, am I audible to you now? Because someone messaged not audible. I think is now clear. Okay.
Yes, clear, clear, clear.
Okay. So until now, is there any question regarding ethics and palliative? Do you have any question?
Ma'am, this ethics and palliative lectures on which group on your
It,
Telegram or where?
are you in my groups, like WhatsApp group or Telegram? Anywhere are you?
Yes, I'm Dr. Sahreen. I'm with you in the group in the new page.
Okay. If you are in my any group, I will share today this Telegram channel in every group. Okay, the
Okay,
channel
ma'am.
link,
Okay,
so
ma'am.
that you my two channels are very popular channels. One is Telegram channel for materials, another is my Facebook channel. That name is MRCPCH Clinical Group of Excellence. In
Yeah.
that group I gave 4 or 5 live sessions. About every session is about one topic, like ethics and palliative. Most of the people here, they are from my groups, so most of them already saw that live, but I will share today the group link, okay, so that you can join.
Okay, ma'am.
And
Okay.
there is a folder for live sessions. Okay, I collect it in one folder. You can just click that folder and you can saw those.
Sure,
So
ma'am.
ethics,
Sure.
yeah. So ethics and palliative are from my sessions, live sessions, and from RCPCH books, like Everyday Medical Ethics. That is also very good. Okay, and then there are some other books, like we prepared some notes. Actually, when we did exam, we prepared some notes, and during our class, during our session, that is paid session, we usually discuss from those notes. Okay, our students discuss with us that, madam, if this question comes like this, then what will happen, that what will be our answer, because same question can be can come in exam in different pattern, like a child having sex with 13-year-old boy, a child of 13-year-old and having sex with 13-year-old boy. Now she came for contraception, what you will do? A girl of 13 year having sex with 19-year-old boy. She came with contraception. Now what will you do? So these two question answer is totally different. Okay, because one is there is no question of child abuse. Another, there is a question of child abuse. Okay, so the answer pattern will be changed in ethics. Okay, and palliative also, like a child having morphine came with the features of intestinal obstruction, abdominal distension, no bowel sound. What will you do? A child having taking morphine, having constipation for 3 days, not passing stool. What you will do? So the same question, but management is totally different. So we discuss in our class this ethics and palliative, how to easily crack these answers. Okay, because there are certain tricks, there are certain tips which you need to know, most important. Okay, now, coming to recall, I must say recall is the key to pass. Okay, this is the golden key you can pass. And I have many sessions in Facebook, in my YouTube channel, many sessions which I took for recalls. Like last neurology session, that was also recall. Before that, I took one session for FOP recall. Okay, so most of the time I took free sessions for recall, because recall is the key to pass. Okay, daily try to solve 10 recalls at least. Okay, I'm telling about everyone. Here are my students also. Some are in live listening live, some are here. So what I am trying to say, that recall, we will definitely come in exam. Like 20%, usually 20 to 25% question they give recall. Okay, that means repeat. So these questions, very favorite question, like salbutamol. I must say every exam they give salbutamol, mechanism of action of salbutamol, what is the relation with metabolic acidosis, alkalosis, potassium balance, and sugar balance of salbutamol. Very common question. Okay, when you will do recall now, you will see that some question are coming every year. That means this is their exam favorite question. Every exam has favorite question. Like when I passed FCPS in pediatrics in 2013 from Bangladesh College of Physicians and Surgeons, that time also I when I was analyzing the questions, I saw there are some questions that are coming every year. Okay, so in every country, like AMC exam, PLAB exam, MRCP exam, or USMLE exam, any exam, you will see some question are coming again. That questions are, you should, you must know those. Okay, if you miss those questions, then it will be very bad luck for you. So I am going to tell you that recall is the key to pass MRCPCH exam. So whenever you find time, you have some small groups or you have some friends, okay, sit together and then try to solve recall, because recall has many mistakes. Recall means I went to exam hall, I gave exam, and I come back and then I write it down, and then I share it in groups. This is called recall. Okay, so while I am writing it down, maximum points I forgot already, maximum answer I already forgot. Okay, so these recalls are incomplete question, and the answers are, maximum answers are wrong. So when you are following the recall, what you should do, suppose salbutamol side effect, what we should do, we should read the salbutamol side effect from an authentic book. Now, from where to read pharmacology, from where to read microbiology, this usually many general population usually don't know. Okay, any book is good, but for MRCPCH particularly, there are certain books. Okay, from where we will read pharma, from where we will read patho. And in our class, usually we made notes of my handwritten notes and my computerized notes. I have many resources which I usually share with my students. Okay, now any question until that, until this much, like for books, we are discussing for books. Okay, now
Where
the, yes,
is
yes.
where will get the recalls with the exact and right answer? Because I have got a recalls which is having, basically having, sometimes actually I confuse is the right answer or wrong.
Exactly, right answer. Actually, not all the recalls you will get. Okay, but
Hmm.
when we will discuss in our class, I will correct maximum recalls. Okay,
Okay.
Yes, perfect.
Uh,
Thank you.
Ma'am, regarding recalls could be from 2018, 19, or 20 or 17. It could be like that.
I gave you from 2015.
Oh, okay, okay, ma'am.
Yeah.
So where it is
Any more?
available?
Mm-hmm.
This
Sorry?
record from 2015, where it is available? It is on Telegram or something
No,
different?
in our sessions, we will give in our session. Okay.
I didn't get your voice is cracking.
I don't know.
No, no, it's
Everyone.
better. It's better now.
Okay, okay. Yeah, we will give you. Don't worry. My students, who are my students, they will know slowly the classes pattern, the lecture pattern, the recalls pattern. Okay, don't worry.
Okay, thank
Any more question, anyone? Okay, now the sample paper. What are the sample paper? According to the name, sample paper is delivered by the RCPCH. Okay, the sample paper which is given by RCPCH before the exam day, like 3 or 4 days before the exam, they will send some question in your mail. This is sample paper, and we collected it because we know we have to give exam again and again. So we collected it for our friends, for myself. So these sample papers has a vast collection, like last 5, 6 years sample paper. But maximum sample papers you will see common. I mean, every sample, every year, the similar sample paper is coming. Okay, these questions are very, very important for both part one and AKP, the sample papers. Okay, now the survival guide or illustrated textbook. Yes, for FOP, okay, as FOP is a clinical exam, I all time say that FOP is a clinical exam, TAS is a basic exam. So you should read a clinical book. See, the guidelines, FOP cases book, they are clinical books, but you should know a little bit theory before the clinical, like survival guide and this illustrated textbook. They are very good. They are also very good for clinical topics. Suppose what are the types of CP, cerebral palsy? What are the types of asthma, and what is the management of chronic asthma? When we will discharge the patient, like this. So remember that this type of clinical question you will only get answer from survival guide or illustrated textbook. Okay, so this survival guide illustrated textbook, I will recommend you should read at least some chapters which you will find difficulty. Suppose you are very weak in neurology, so I will advise you, please read neurology from illustrated or from survival. Okay, if you are weak in metabolic, please read from survival metabolic is very good. Okay, survival genetic chapter is very good. Okay, illustrated textbook CP chapter is very good, like neuro disability. Okay, so this is my point. Whenever you feel stuck in any chapter, just go through the survival guide or go through the illustrated textbook, and believe me, it will help you in AKP also, because in AKP we read these books, survival guide and illustrated textbook. These are, they explain theory very well. Okay, so these are the FOP cases MOOC. Now you can ask if you have any question, and I want to go directly on web page. That this is RCPCH web page. Okay, this web page has syllabus. You can see the screen, theory, exam structure, and syllabus. Okay, and you can see the account. This is rcpch.account.uk.ac.uk. This is the RCPCH. This is the account. Okay, you can see this in your toolbar. So MRCPCH theory, structure, and syllabus. This is the last modified session. Okay, 27 May 2020. This is the last modified subject. So this is the syllabus. Okay, I think you can see the syllabus for theory exam for both candidate and their teachers. It is the outline. It outlines the core knowledge requirements for each section of the exam. These topics are this syllabus is both for AKP and part one. Okay, so first see adolescent health. Adolescent health means teenager health and medicine. I can surely say this is the most neglected topic. Adolescent health and behavioral medicine or psychiatry. This is the most neglected topic in MRCPCH. But every year, usually question comes from this. What is adolescent health? Like question will come from substance abuse, or behavioral problem in adolescent, or suicidal tendency of adolescent, sex life of adolescent. And behavioral psychiatry mane psychiatry like ADHD, autism, then will come in depression, okay, anorexia nervosa, these will come in psychiatry. Cardiology, dermatology, emergency medicine, emergency pediatrics, like question will come from status asthmaticus, status epilepticus, burn, okay, scald. Then non-accidental injury, very very important, it is the part of acute emergency. Okay, every non-accidental injury, whenever there is suspicion, you should admit. This is the core, this is the core point, you should admit. You cannot discharge any non-accidental injury patient because there is a suspicion. And how you will suspect it is a case of non-accidental injury, we have a class, that is ethics class. In our class we will discuss detailed that in which area, if you find an injury, this is a part of non-accidental injury, in which area there is accidental injury. Okay, there is a detailed class. And gastroenterology, hepatology, genetics, and dysmorphology. This, I must say, in UK exam, as this is a UK based exam, okay, I must say that genetics and dysmorphology is very common, very very common pattern, question pattern, because they have many genetic disease, and the genetic disease in UK, their life expectancy is more than in any other country in Asia and in Africa, because in Europe their treatment is very upgraded. So any dysmorphic child like achondroplasia, Down syndrome, their life expectancy is very high than in Bangladesh, India, Pakistan, because we neglect usually the genetic case and dysmorphic cases. But in UK, they treat every child as important. So in their country, genetic childs or genetically abnormal childs or dysmorphic childs, their life expectancy is good. So they usually give these genetic cases in AKP, in part 1, in clinical also you will see they will come, like Down syndrome, very common, Down syndrome, Turner syndrome, Williams syndrome, Angelman syndrome, then Prader-Willi syndrome, Marfan syndrome, homocystinuria. These questions are very very common. The people who give exam in Bangladesh, India, Pakistan, I don't know how much genetic question you face, but in my exam I did not face so many genetic question. I can guarantee that we did not face so many genetic question. But in MRCPCH we've already faced many question from genetic and dysmorphology. And when we take class, usually the FOP cases book or task cases book, whenever there is any genetic syndrome comes, I usually give some mnemonic. I used to do give some mnemonic, some formula to remember. Otherwise, it is very difficult to remember the dysmorphology, the genetics pattern. Okay. Now the hematology, oncology, infection, immunology. Immunology is a very important chapter. Immunology is very advanced in UK. So there are immunological drugs like, interleukin 1 receptor antagonist, interleukin 6 antagonist, then tumor necrosis factor antagonist. These drugs are very, very common. Anakinra, infliximab, adalimumab. These drugs are very common in UK. They use these monoclonal antibodies, and these drugs are a part of immunology. So you have to know the basic immunology, like what is complement pathway, what is alternate pathway, how our body is reacting to immunology. And this we have a class, we have a session for this immunology. Now the metabolic medicine, very very important. Metabolic, genetic and metabolic medicine. Metabolic disease, what are the metabolic diseases? Most of the metabolic diseases we know are autosomal recessive, right? But some are autosomal dominant, some are X-linked recessive. You have to know very clearly these metabolic diseases. And metabolic disease has a certain pattern of presentation. We have a very excellent session about this metabolic class, and our students usually enjoy a lot this metabolic. Before that, my students used to say that, madam, before I joined your session, this metabolic was a terrifying topic. Now it feels like, ABCD, this metabolic, because when in which metabolic disease the ammonia will be high, in which metabolic disease glucose will be high or glucose will be low. This is a very, very easy formula. They have an easy formula, and you can remember by this easy formula. In which metabolic disease there will be metabolic acidosis, in where there will be no metabolic acidosis. So they have an easy formula. You can easily grab this. Okay. So metabolic is very important. Musculoskeletal, neonate, as I am saying that neonatology previously, neonatology was not so, not many questions were coming, but nowadays neonatology is very, very paid topic, and the exam pattern is changing. Okay, nowadays they are giving more neonatal questions. And neonatology, we have to remember that some people will tell you that neonatology no needed, not needed for part 1, part 2, not needed. But I tell you one thing, without neonatology, your basic pediatrics will be missing. Okay, your basic pediatrics will be missing, because a pediatrician supposed to do resuscitation of a neonate. Okay, this is not required for a neonatologist. Okay, in many countries, many part of the world, many hospitals, they don't have neonatologist. The pediatrician act as a neonatologist. So neonatal care, I feel this is the vital part of pediatrics. If you don't know neonatology, then you are a very weak in pediatrics. So I will suggest you, please read neonatal guideline, please read neonatology, and do practice in your hospital, see many neonates. Okay, it will be very easy for you. And in our setting, like in Bangladesh, India, Pakistan, we must see neonate. We must see. We are habituated in neonate from the first day of our life. Like I was posted in pediatric surgery for 3 months. There also I saw many neonates presented with gastrointestinal obstruction or tracheoesophageal fistula or lung, CCAM, that is adenomatoid malformation of lung, needed surgery. So I saw many neonate, they required surgery. And during my neonatology training, every day there is a night call, evening call for resuscitation. We are going into the OT operation theater, and we just wait outside the room. And as soon as the child delivered, the baby delivered, we resuscitated. This is a part of training. So what I am trying to say that don't neglect neonatology for MRCPCH part 1, part 2, and part 3. Many people will tell you, many teachers will tell you no need, but I tell you, neonatology is the core part of pediatrics. If you are weak in that, your all exams will be very weak. Okay. Now, nephrourology, very important, nephrology, then neurodevelopment and neurodisability. Yes, very important. Then nutrition, ophthalmology. Regarding ophthalmology, what I am trying to say that some ophthalmology, basic ophthalmology, as a pediatrician, we should know. Like a child having squint of 3 months, he has fixed squint. Another child has squint 3 months, but he has intermittent squint. Now, who can tell me which child you need urgent referral? Fixed squint or intermittent squint? This is an open question. Anyone can answer.
Fixed squint.
Fixed. Fixed.
Fixed squint. Yes. Why? Fixed squint indicate what and intermittent squint indicate what?
If it is recent, like fixed squint, if it is recent in few days,
Yes.
it indicating that there is some space occupying or central nervous system problem is happening inside. And if
Yes.
it is intermittent in the kids, it is usually related to the error of refractions
Yes. Very
inside.
good. Because in a newborn child who has intermittent squint, this is because of the growing eyeball. During the growing eyeball, and their nerves are maturing, like optic nerves, they are maturing, oculomotor nerves, they are not so much mature. And this growing eyeball, there may be sometime intermittent squint, and that is completely fine until 6 months, completely fine. But a fixed squint indicate there is some space occupying lesion or something. Okay, so and a recent onset squint, suppose a 8-month-old or 9-month-old child who did not have squint, but now there is a fixed squint, and this is an emergency. You have to refer the child emergency, because this is a chance of intracranial pressure increased, because the because the nerve because the nerves who are which are traveled a long pathway, like sixth nerve, abducen nerve, they have a long pathway intracranially. So whenever there is a raised ICP, this nerve get compressed, and they usually causes queen. So is what I'm trying to say, that is some sort of ophthalmology is important for your exam, for our exam and daily life, our daily practice. Which child need urgent care, which child do not need urgent care? This is the duty of a pediatric register or a pediatric OPD doctor or a GP. So some sort of ophthalmology is important, and in our section, in our teaching sessions, we usually highlight those topics which we should know. Not all the things like cataract, how you will manage cataract, no need. Cataract is a chronic condition, but in acute condition like uveitis, like squint, fixed squint, refractive error, these are the acute condition. If you don't treat refractive error, what will happen? There will be amblyopia, permanent loss of vision. So this is an acute condition. So like these things we will discuss in our sessions, and also the students are here, you should also highlight this ophthalmology few topics. Now, patient safety and clinical governance. This is a part of ethics. Okay, how you will make a child safe at home, at community, at school, even to you. Like a child who is requesting you, a 12-year child who is GILIC competent, or a 13-year child who is GILIC competent is requesting you not to tell the parents about the contraception. Okay, will you tell the parents? No. If there is a chance of child abuse, you will tell the social worker, not the parents, because you will encourage the child to tell the parents, but directly you cannot breach the confidentiality. Directly, you cannot breach the trust of your patient. If you breach the trust, what will happen? This child will never go to pediatrician, because she knows that she cannot trust a pediatrician. Okay, so this is called patient confidentiality, patient safety, and clinical governance. So any patient, okay, is your responsibility when he comes to you. If you don't give treatment, or if you can't give treatment, at least you can refer, you can guide him or her to the appropriate center. This is called patient safety and clinical governance, and it's a part of ethics. Now, next is pharmacology. And pharmacology, I am telling you, this is the skeleton of medicine. As we will become a pediatrician in future, this is the skeleton of our knowledge. If we are lacking behind this pharmacology, you cannot succeed in life. You will be caught up in a way in any hospital, because you will give wrong dose in a wrong formulation in a wrong time. Okay, you don't know it is given in push or it is given slowly. If you give vancomycin in rapid IV push, the patient will die, because vancomycin has a serious anaphylactic reaction and it causes red man syndrome. So, and there is another drug, adenosine. If you give adenosine slowly by 30 minutes, it will not act at all in supraventricular tachycardia. So, as a pediatrician, as a medicine doctor, you should know which drug you should give rapid push and which drug you should give over 1 hour. Okay, and what is the dose, what is the maximum dose, what is the toxic dose, and what is the cumulative dose? Okay, the dose which deposited in the body, this is called cumulative dose, like cyclophosphamide, they usually deposited in our body. Okay, so these are the pharmacology, and as a pediatrician you should have a very good grip in pharmacology, otherwise you will stuck anywhere. Another important thing in pharmacology is side effect. Like as I already said, that salbutamol side effect, ipratropium bromide side effect, steroid side effects, these drugs, metformin side effect, insulin side effects, these drugs are rapidly coming question, and very favorite question in MRCPCH. Okay, this is pharmacology. Another is respiratory medicine, ENT. Yes, you should know the nice guideline of respiratory medicine and ENT, like tonsillitis, acute respiratory infection, otitis media of effusion, or acute otitis media. You should know the nice guideline. Otherwise, you cannot manage in the community which patient you will admit, which patient you will not admit, and which patient you will give follow-up after 5 days, which patient no need of any follow-up. This question will come, like acute tonsillitis. Will you give follow-up or not? Will you do operation or not? Will you refer to ENT or not? These are the questions that is coming in your exam. Until now, any question? Anyone? And then safeguarding and science of practice. Science of practice means how we will write prescription, and there will be some question regarding statistics. There will be clinical governance. There will be medical audits, medical that is called, usually called, part of medical journals. Okay, like this is a core part in your knowledge. Like you are doing a treatment, you are giving treatment of a pediatric patient, or you are working in hospital. This is not the maximum. You have to do research, you have to improve your clinical knowledge. So this is the part of Hello, am I audible to you? Sorry, maybe the network issue.
Yes.
Hello. Okay, okay. Just what network is fluctuating. Just 1 minute. Give me 1 minute. Okay. So we discussed about the FOB books, and we discussed about the syllabus. Now, is there any question anyone having about regarding FOB or regarding the syllabus? Do you have any question, or we will go to the next slide? Okay. So this is our next slide. Our next slide is consist of task cases book. Okay. So the task cases book. Okay, so the task cases book is 50 cases for task exam, as like this FOP cases book. RCPCH published the task cases book also, 50 cases, and every case is very, very excellent, nicely described, nicely elaborated, like 50 clinical cases book. If you read first case, you will come to know pharmacology, published the task cases book also. Okay, you will come to know the pharmacology of ipratropium bromide and ophthalmic pharmacology. Okay, and there is some chapter of skin dermatology. I think 789, chapter number 789. You will come to know what is impetigo. You will come to know what is pemphigus. You will come to know what is the difference between staphylococcal scalded skin syndrome and impetigo, and how many layers are there. So task cases book is very, very basic. Though this is a case wise distribution, the book is written so well that they are like a case. They are like a case, but they actually are for basic pharmacology, basic microbiology, basic pathology, like this. Okay, so you will read in a style. This is task cases book. First time when I read this task cases book, I find it very difficult to memorize. Okay, And I will tell you that whenever you read one case, you just make some notes, that like from skin chapter you make some notes, that what is the toxin of impetigo, what is the toxin of staphylococcus, how investigation, how manage. So make some notes on your book or on your notebook, so that whenever during revision, whenever you are giving revision, you highlight those notes. Okay, this is my style, that I usually make notes in the book, some short notes. So what happens when I open my book? First of all, I highlight my notes. I look at my notes, that what is the important point in this chapter. Then it is very easy. Then this task clinical cases book become very easy. Now, the Science of Pediatrics book. This Science of Pediatrics book is very, very broad book, but I must say this is the main book for TAS. Okay, this Science of Pediatrics book, every chapter is written in such a manner that one trainee who is very new to pediatrics, he should read it actually. But some people who are senior, like they already read Nelson or some other books, so they can only just read the highlight points and read the boxes. Okay, but for the trainee who are new in pediatrics, who are just started their journey, they should read this book once. Okay, and this book has lot of chapter, like 50 chapters. Every chapter, they have own importance. Like this book has some pharma chapters. This book has, just 1 minute. Sorry for this call. Okay. Okay. So, what I'm going to say, the Science of Pediatrics has pharmacology chapters, and they have statistics chapter. Okay, most important chapter, statistics. It has quality improvement project. The Science of Pediatrics has audit, how we will do an audit. Okay, so don't neglect this book. Okay, many people will tell you that Science of Pediatrics, no need, it is a very big book, you will waste your time. Studying is never wastage of time. This is my comment. Studying is never a wastage. Even if you read this book and your time become wastage, I am happy. Okay, and this book has very systemic pattern of boxes, like pharmacology box or investigation box or complication box. So you can go by these boxes, and you can remember these boxes. And ethics and palliative, already I discussed that. TAS exam also, there will be some ethics and palliative question. And pharmacology, I already discussed that pharmacology is the core. And this pharmacology also, the recalls are very important. Like recalls are coming in exam. Okay, so please read the recalls for pharma, and also read from any good book, any good source, the basic pharmacology. And what is basic subject for TAS? Basic subjects like microbiology. There will be many questions from cocci, bacilli, fungi, and viruses. Many questions like gram negative, gram positive, motile, non-motile. Okay, which one needs which antibiotic? Okay, vancomycin acts on which gram positive or gram negative, gentamicin acts on gram positive or gram negative, like this. So this is the basic microbiology you should know. And also immunology, metabolic medicine, they are also in this part, basic subject. Genetics, like you know they will give you karyotyping, one picture of karyotyping, and which kind of trait it is autosomal dominant or autosomal recessive. This is also basic genetics, you should know the structure. Okay, now the sample paper I already discussed. Sample papers are released by RCPCH, so very important. Recalls I discussed, very important. Statistics. Now the maximum students who are my students, they actually complained that madam, statistics were totally zero. So I gave them the notes, sometimes my voice notes, because class 1, class 2 class is not enough for them. So sometimes I used to teach them with my notes, making by my handwriting or voice or any kind of. I usually describe shortly, I mean part by part. Okay, what is the statistics? And one important question I ask everyone, that what is the need of reading statistics? Can anyone answer? What is the need? Why we are doing so hard work for statistics? Anyone can open mic and answer this. What you feel? I mean, why we are reading statistics? What you feel? Anyone?
Ma'am, when we want to do any research, then it is very important to find out a conclusion, and by statistics we can find out our significance about any disease or any medication or any study related
Yes.
to our subject.
Yes. Why you are doing study? Can anyone tell us why? What is the need of doing study? Any research? What is the need?
It is needed for treatment purpose or any change in our treatment or procedure, or it can give idea about the uh, disease
Like,
process, or actually it has many aspects.
yes. Can you give me an example about this corona, recent corona, COVID-19? What is the importance of statistics here in COVID-19?
Um, Such as in this COVID-19 situation, many study have been done about the efficacy of drugs on this virus,
Yes,
and
yes.
also the age pattern, many other aspects.
Yes, suppose we need a treatment of COVID-19. So how we will treat? We need statistics. We need the symptoms. Okay, what is the harm doing by the COVID-19? So these are all research. Another important aspect of statistics is the continuous development. Okay, because medical science is a part of the education that needed continuous progression. Suppose we previously we used to give one treatment, but now we saw that this treatment is not good, this has side effects, so we need a better drug. Okay, previously we gave steroid in GIA. Okay, only we had steroid, but nowadays we are seeing that we have methotrexate, we have cyclophosphamide, we have cyclosporine, we have tocilizumab, we have monoclonal antibodies, so we are giving that because steroid has side effect, many side effects. So this is the continuous development, and for this continuous development we need study, we need research, and for that reason statistics is a vital part of medicine. Even in surgery, any field of medical science, statistics is very important. Okay, so any person who thinks that I will not read statistics and then I will pass exam, yes you can, but in a one point of your life you again have to come back. Like I'm giving you one example. Suppose I am 40 years of age, I am consultant, now I am giving exam. Some students already passed MRCPCH exam and became consultant in UK. So they started MRCPCH at the age of 25. Okay, and some students started at the age of 35, some at the age of 40. That means what? That means different people, they use this MRCPCH in different age group. Okay, so this is actually this is your choice. Okay, this is your choice, this is your lifestyle. Okay, and it will not match one with another. Okay, so if you not read statistics now, what will happen? At the age of 40 you have to again come back, and then you have to again start what is significance test, what is positive predictive value, what is negative predictive value. But when you read MRCPCH, you already did these things, you already know these things, you have idea. Okay, so any part of your time, any part of your growth, any part of your training, you must come back. So that is my point, that some students they usually dislike statistics. My point is that any part of your career life you have to come back, and you have to do the statistics, you have to read the statistics. So better if you start from now. And in MRCPCH AKP and clinical there are statistics. Okay, in clinical also you have to explain the medical student about the audit, about the quality improvement project, about the side effect of drug, how the guideline is making, how the what is the importance of guideline. Now these things you will only find in statistics chapter. Okay, and we have two classes I think in our February batch, and these two classes we will do only statistics. Okay, and I will give some notes and some tips, some tricks by which you can easily crack this exam. So any question until now? We discussed task cases book. We discussed FOP cases book. Any question until now? Anyone? Okay. If no question, then I will do one thing. This is a, I think the screen is visible. Mm, yeah, the screen is visible now. So you see how you will make an account. So the people who who have not made the account, please make account now, because in January it will be very busy. In January last week it will be very busy because the February they have exam. So you should make account when there is no exam. Like in January month, you can make this exam account, RCPCH account UK, get your exam account. How to do your exam account? See, they have given the table here when to register. When there is no exam, you can register for your account. First, create your RCPCH online account. They will give you one number. Okay, from this number you will be identified, and this number is for lifelong until you pass whole the exam. Okay, this is the lifelong number. Check your details and correct. There will be your name, age, address, nationality, your certificate. You can upload your PDF certificate of your bachelor degree, MBBS certificate. Then when the exam window will open, like for February exam, window is closed now. You cannot book February exam, it is already closed. So exam window will open at least 2 to 3 months back of the exam. So that time is they will give you only 7 day or 5 day for exam window. This is called window. So in this window you have to register or book for the exam, and that time you need a MasterCard or Visa card. That is international transaction is possible. Okay, you will call your bank that I need an international transaction. So then you will pay with the credit card. So this is the booking for exam. Then if there is any problem at any point, you can mail RCPCH directly, and they are very helpful. They usually reply within 1 or 2 days. Okay. And if your name is, you should remember your name and your password, ID password. You should write it down in your Google Drive so that you cannot lost it. In your name, if you change your name, there are certain procedures. Okay, so this is how we will open our account. This is the RCPCH account.uk education career examination. Okay, this is your exam account. Any question until now? For DCH, actually, I have no idea about the DCH, but I know only that yes, DCH, for DCH FOP, same syllabus. And after passing that FOP, you can go for DCH clinical exam. But the main point is DCH clinical exam, you cannot get registration by GMC. Okay, for GMC registration, you need to pass PLAB or MRCPCH. Okay, either PLAB or MRCPCH. You cannot get GMC registration by DCH. So it will not helpful for registration or job, but definitely you can do DCH and you can use it as a degree, because diploma is also a degree, medical qualification. You can use it, and also it will highlight your CV that you are interested in pediatrics. Okay. Okay, Dr. Sachin question that these all book and illustrated textbook both are same. No, illustrated textbook of pediatrics is different, yellow color book, and science of pediatrics is different book. They are not same book. Doctor asking FRCP. Doctor, FRCPCH is not an exam. Okay, FRCPCH is a fellowship that will be given by the RCPCH when you are already a consultant. When you are already a consultant and you will be doing some great work, or you have already done your MRCPCH, that is called fellowship. Okay, fellowship is not an exam. This is a qualification. This is a criteria. If you fulfill this criteria of the Royal College, then you can get fellowship. But fellowship, for fellowship you need two things. One is MRCPCH part. MRCPCH you have to complete, and you have to prove that you are a consultant. Another is if you did not do MRCPCH, but in your home country You have to prove that you are a consultant and doing national level job. For those people who did not do MRCPCH, for them getting the FRCPCH is very tough because you need to be a national professor. Okay, so read the criteria. Yes, I know the criteria, but you have to read this criteria because today our topic is not FRCPCH. Our topic is MRCPCH. Okay, so you have to read this criteria from the Google. Okay, now any question?
Yeah, I have a question.
Yes, please.
Which book is wise to follow? Illustrated textbook of pediatrics or science of pediatrics for part 1?
Okay, that is a debate. Okay, 50% follow science of pediatrics and 50% follow illustrated textbook. But what I suggest in my students that science of pediatrics is a book for theory. Okay, an illustrated textbook is a book for clinical. So illustrated textbook will help you in FOP, but mainly for TAS exam, you need science of pediatrics. Okay, clear? Okay, any more question? We already crossed, I think, around 1 hour. So I think we should now take leave. But if you have any question, you can ask. Madam, discuss about, what is that? Discuss about the second page. Second page means what? This one I discussed. Second page, that is nothing. That is the exam question. This is the second page, right? Second page, there is some printing mistake. So the MRCPCH part 1 has two paper like FOP and TAS, and question are like 90 to 100 question. There will be extended matching question 6 to 7. Sometimes it is 10. In TAS, it is more. In TAS, okay. In FOP, it is like 6 or 7. Then two types of question like single based answer, and another is extended matching. Okay, and time is 2.5 hours, and there are 3 sessions per year like February, June, and October. Okay, now online examination is possible, and for fees you have to see this RCPCH. This is the website for fees. Okay, this is the second page. Now many people ask me about the prospects of MRCPCH, that if I do MRCPCH, if I don't go UK, is there any prospect? Yes, this is the highest postgrad degree in UK. After this, you need no degree. Okay, you need no degree means you will get FRCPCH by time. Okay, and can work as a specialist in other parts of the world. Like you can work in Australia, in Gulf countries, in many parts of the countries. They are recognizing MRCPCH as a specialist. And in Bangladesh also, there's a highest value after FCPS, because FCPS, MD, these are Bangladeshi degrees, and these degrees are widely recognized in Bangladesh. But MRCPCH also, if you are working as a consultant and you have passed MRCPCH, then definitely it will give a value. Okay, and now I am in the last part of my question. Thank you for joining, and this is my contact number for the course. If you want to join my course, there is a very good batch. We are already finished the enrolling. I will maximum take 1 or 2 students, because already I have crossed 20 plus students in my new batch. So this is the last enrollment. Just I'm muting the mic, sorry. Yeah, so this is my number. You can contact me for the February batch. They will be ready for a June exam. Okay, this is 3-month course. We do 2 classes per week, average 2 to 3 hours, and we will discuss like systemic, like FOP class, task classes. There are some basic classes, pharmacology classes, statistics classes. Okay, any question now before we leave? And how was it important for you? I mean, was it helpful for you, this session?
Yes, ma'am, it was.
Yes. Any question you have, Dr. Triveni?
Ma'am,
Yes, ma'am. I have. What about, ma'am? Past test papers and online. Is it useful or?
Yeah, it is a very, very useful if you take it as a practice. but there'll be very, very minimum question from that. Past test is not a question bank for MRCPCH. That is just a revision. Mane, you will practice it and you will expertise yourself in MCQ. This is a MCQ bank. They are not related with RCPCH, but it is a very good
Okay.
for knowledge. Yeah.
And ma'am, regarding sample papers, as you told before, from where we will get these sample papers?
You are
For
my batch, right? You are from my batch now, Dr.
yes,
Shireen.
yes, ma'am, yes.
Yes, yes, you will get. You will get. And
Okay,
the people who are not in my batch, you can take help from my Telegram channel. I shared sometimes long back these sample papers from. Okay, in my Telegram channel, I shared everything actually. Okay, so don't be disheartened. You will get that already. And my batch, who are in my groups, WhatsApp groups or Telegram groups, they already have these materials. Okay. Any question now?
Ma'am, one more question. And we have MCQ essential questions for MRCPCH. That question
No
bank
need.
is useful, ma'am.
No need. No need. No need. MRCPCH question you will enough read by past test, recalls, and these sample papers. Enough. No need any other MCQ book.
Okay, okay, ma'am. Thank you so much.
Yeah. So everyone have a very good night and very good study. Wish you all the best for February exam and also take preparation from for June exam. Okay. So we are
Ma'am,
taking
do
leave.
we need to purchase separately past test also if we are joining your batch then also?
No, 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 no. For my batch, actually, my students only will get my materials, which is free. No need of purchasing past test in my batch. Okay,
Okay, thank you
you
so
will get.
much.
Yes. Thank you, everyone. So I will come again with another important session. Thank you very much for joining, and see you inshallah again with next class. Okay. Bye bye. Take care. Okay.
bye, ma'am.
Bye. Thanks. Thank you.
Thanks. Thanks.